Good morning, students. So today's topic is Cushing reflex. Cushing reflex basically seen in the conditions of raised ICP or raised intracranial pressure. So what are the causes of raised ICP? Here I have enumerated some causes of raised ICP. The head injury, subarachnoid hemorrhage, hematoma, intracranial space occupying lesion, ICSOL, infection, cerebral edema, even in the status epilepticus, the ICP is raised. So if there is raised ICP, this is the schematic diagram I have already drawn, and suppose this is brain parenchyma and this is the intracranial space occupying lesion. So because of the mass or tumor space occupying lesion, the surrounding brain tissue which is compressed. So because of the ICSOL, the compression of brain tissue, and this compression of brain tissue, because in the brain parenchyma there are multiple vessels are also present which supply the brain parenchyma. So these vessels or blood vessels, they are compressed by the surrounding tissue. So the brain tissue surrounding the so the brain tissue compress the vessels, and these vessels are, there is vasoconstriction. So if there is vasoconstriction, it will cause reduction in the cerebral blood flow or CPP. What is CPP? CPP is cerebral perfusion pressure. Cerebral perfusion pressure is mean arterial pressure minus ICP. As we all know, because of the tumor, because of the infection or other condition or head injury, the ICP is raised. If the ICP is raised, that means CPP is reduced. So reduction in the cerebral blood flow or CPP, that will cause, because the blood supply oxygen to the brain, so there is reduction in the oxygen supply and there is more CO2 which is got accumulated in the brain parenchyma. This CO2 combined with the water, react with the water, and that form H2CO3. This H2CO3 then divided into H ion, proton, and the bicarbonate. The H ion is very important chemical ion. So this H ion, they activate the central chemoreceptor, and these central chemoreceptors, they cause sympathetic outflow. So there is sympathetic activation. Because of sympathetic activation, it will cause increase in the blood pressure, and this is the very special condition where only systolic blood pressure is increased and the diastolic pressure is decreased. So there is wide pulse pressure. Right? Because there is hypertension, so the baroreceptor get activated and it will cause vagal activation, so that will cause reflex bradycardia. So there is reflex bradycardia, and because of the accumulation of the CO2 and there is hypoxia, so there is also irregular breathing. So this all 3 points which is very important: the hypertension, reflex bradycardia, and irregular breathing. It forms Cushing reflex or Cushing triad. But because of the ICSOL or there is increase in the pressure in the cranial cavity, the other symptoms are also present, which is called projectile vomiting, because there is parasympathetic or vagal activation. There is headache and papilledema. What is papilledema? Papilledema is actually blurring of the margins of the optic nerve. Suppose in the eye there is optic nerve, right? This is the optic nerve and this is the retina or the eye globe, right? So this is optic nerve margin. This got blood. This is called papilledema. Why it gets blood? It is because we all know the retinal artery supply the eye, and the retinal vein which drain out the venous blood from the eye. But renal artery is high pressure system, and the the retinal artery, it is the high pressure system, and the retinal vein, it is the low pressure system. So because there is raised ICP, so the retinal artery, they can very well tolerated the raised pressure, but the retinal vein, which is the low pressure system, it actually cannot tolerate the pressure generated by the brain parenchyma. So there is compression of the retinal vein, and this will cause drainage, this will cause compression of the retinal vein, and the drainage, venous blood which is drained by the retinal vein, it will not be possible. So drainage cannot be possible out of the eye, and there is accumulation of the venous blood around the optic nerve, and there is blurring of the margins of the optic nerve, that is called papilledema. Hope you like this video. Thank you so much.